As COVID-19 cases continue to rise across the country, health officials are now issuing a warning that people with excess weight are at an even greater risk.
It's not only obesity itself, but it's the complications and comorbidities that overall increase this risk.
Dr. Donald Hensrud is the director of the Mayo Clinic Healthy Living Program. He says nearly half of the population is either obese or overweight.
The latest figures show that 42% of the adult population is obese and 32% are overweight.
Health officials say people with obesity are more likely to experience dangerous COVID-19 symptoms.
In COVID-19, we see an overactive, kind of an exuberant immune response, and it's very easy to tip our chronic inflammatory state towards a very hyperactive state, which causes, which can have severe repercussions on the life or death of the patient.
According to the CDC, obesity disproportionately affects some racial and ethnic minority groups, with Hispanic and African American adults more likely to suffer worse outcomes from COVID-19 due to many factors, including economic, physical, emotional, and social inequities. Although health officials say systemic change and long-term weight loss take time, there are steps everyone should take to slow the spread of COVID-19.
I would hope that patients realizing that we have an unprecedented pandemic, that they can kind of take their active and healthy lifestyle more in their own hands.
In Minneapolis, Charmaine Nero, KARE 11 News.
And health officials say stress and not getting enough sleep can also lead to severe illness from COVID-19.